Thank you for participating with us in this video presentation. This was designed to help you as a patient to prepare you well for surgery. We decided to do group pre-op visits because we felt like by doing this you could have more time to prepare for surgery and get more information, understand the risk, benefits, how the procedures are done, and get your questions asked. This first part, this video part, is just a portion of some general information that I think will really be valuable to you and help you with preparing for your surgery. We're getting people together in groups with similar types of surgical procedures. For example, if you're going to have a minor procedure, we've gathered you together with other people having minor procedures. If you're having a major surgery, then you'll be with other people having similar surgeries. Minor surgery is considered outpatient surgery. You go in the hospital and you come out of the hospital the same day. Some people call it same-day surgery. Occasionally with minor surgery, you'll also stay 24 hours or 23 hours if you need to be observed overnight. After your surgery, you'll be having a post-op visit. That's usually done about 2 weeks after surgery, and it's at that time we'll discuss your pathology and any other issues you have. Of course, if you're really worried and you have to have some information, you can call our office and leave a message and we'll try to call you back as soon as possible. If we find something that we have to let you know about quickly, we'll call you right away with that information. It takes at least 2 to 3 days, and since most surgery is done at the end of the week, it would take until the next week to really be able to get back with you. So please don't expect quick responses. We're slow to come up with a pathological diagnosis because there's a lot of processing that needs to get done. Now we're going to talk about preparing for surgery. You're going to be told to be NPO. That means nothing by mouth, usually after midnight. Of course, if your surgery is going to be in the afternoon, like 3 o'clock, that might be changed a little bit, and we can discuss that on an individual basis. But NPO means nothing by mouth. When you wake up in the morning, you don't swallow anything. You don't get that cup of coffee, and you don't swallow your toothpaste. You do nothing. Don't chew gum, don't cigarette, things of that sort that make you salivate. When you salivate and saliva is produced, you swallow it, that saliva could come up in your surgery or as you're preparing, and that's not good. We don't want to have risks of any aspiration. The day before your surgery, there are things you can do to help you with your surgery. We often tell patients to take a stool softener so in the next day or two your stools will be soft and you won't have to push on a painful incision. We also advise patients to take a laxative. Laxatives are bought over the counter just like stool softeners. Just look at the labels. You'll even find some stool softeners that have laxatives with it. One other thing that you might want to do is cut your pubic hairs a little bit. We ask patients sometimes to shave themselves just an inch off the top. If you shave by yourself, or you can use scissors, you have the opportunity to do this at your home with nice warm water, and so you don't get the little goosebumps like we would have to do if we did your surgery, your shaving in the surgery. We would have to shave you with a dry razor. That's not really comfortable in the next couple days. If you have surgery done on your bottom side, you may want to take scissors and cut some of the pubic hair a little bit as well. This will really help you. Thinking about some of the other issues, some people have loose dentures, they have loose caps, and bad teeth. You may want to see a dentist before your surgery and make sure things are secure. Many times if you have false teeth, they will be taken from you and put in a cup and held to the side till you're after surgery. All your fake eyeballs need to be pulled out too. Sorry about that, I couldn't resist. If you're taking aspirin on a regular basis, we ask you to stop your aspirin about 10 days before your surgery. By stopping the aspirin, you will let your blood go back to its ability to clot. If you take aspirin, your blood will be thin for 10 days from just one aspirin tablet. You may want to stop a lot of herbal remedies like ginkgo biloba that can also thin your blood as well. Take a multiple vitamin. You may want to take vitamin C. Some people will take 1,000 milligrams or more of vitamin C every day before their surgery. These things help to help in the healing process. You may want to take a high protein diet or protein drinks a week or so before surgery, or even more. It helps to build your your immunity system and systems up like that for recovery. Be careful when you take an over-the-counter medicine. If you're starting to get a cold or flu, look at the label. Make sure it doesn't contain aspirin or aspirin products. Salicylic acid or ASA are aspirin. Stay away from other people who have colds or flu because you don't want to pick up their cold or flu as well. If you're in the waiting room of a doctor's office and somebody's beside you sneezing their brain out, move away or move to another area or ask to be placed in a room early so that you don't pick up a cold or flu. If you get a cold or flu, we'll have to delay your surgery up to 3 weeks to get over the whole infection. Remember, you don't want to have an incision and be coughing or have problems with pain with coughing. Another thing that happens, even people who are getting ready to have surgery for their sterilization, is they get pregnant. So you don't want to get pregnant either, so use your contraception carefully. If you're on your menstrual cycle, that usually doesn't make any difference. In fact, patients who are getting ready to have a laparoscopy and they have pelvic pain with their periods, what better time to look inside the belly than when they're on their menses, because when you're on your menses, then we can see inside and see what might be causing the pelvic pain. We're now going to talk about blood transfusions. Everybody wants to know about blood transfusions. Well, let me reassure you, we don't transfuse blood unless it's absolutely the last resort. And it's extremely infrequent that we would transfuse blood. Of course, if we have a Jehovah's Witness patient, we would honor the request and pretty much do everything we would do with them with anybody else. We don't transfuse blood unless it's absolutely necessary. Some patients will ask, well, what about if I donate my own blood and I put it in storage? Well, you can do that. It'll delay your surgery about 3 weeks, because if we take a unit of blood out of you, we have to put it back in. And it takes about 3 weeks for your body to build it back up again, so you're better prepared for surgery. Now you can ask a family member, and of course they have to have the same blood type as you, but you could ask a family member to donate a unit of blood also, and they'll donate it. You'll have to know the hospital that you're going to, the day of surgery, and things like that. We'll be glad to help you with that. We like family members to donate blood because we never use it, and so then it gets available for the blood bank, and they would love to have extra blood around. Before your surgery, you're going to need to have a pre-op visit with your primary doctor. If you're with an HMO, the primary doctor will order the labs and do the medical clearance. If you're with a private insurance, we usually do a lot of that work for you, and some of the work can be done at the hospital. Your labs need to be completed and finished and available at least 2 days before the surgery. This is important because these labs get faxed to the hospital. And as far as your authorization for surgery, we get that authorization for you. The hospital won't even schedule the surgery without an authorization number, and that's our responsibility. Getting over to the issues of anesthesia. Everybody wants to know what kind of anesthesia we're going to do. The anesthesia that's given is really dependent on what kind of surgery that you're going to have. And the anesthesia is really made, the decision is really made by the anesthesiologist. Most of the time, most anesthesia is done with general anesthesia. If you're having a laparoscopic procedure or laparoscopically involved procedure, you're going to have general anesthesia, just because we need to have control of your breathing and control of your muscles, and we can best do that under general. Some surgeries, especially with minor procedures, we can do it under sedation if you want to be just relaxed, and even local anesthesia is possible. Some patients have had great experiences with spinal anesthetic, and they ask if we could have spinal. That's fine. Some patients, if they want to, they can have an epidural, just like the epidurals in labor and delivery, and there is even such a thing as a walking epidural. Patients who choose this are patients who want to have no pain after surgery, and they walk around after their surgical procedure and have minimal discomfort. These things, again, are arranged with the anesthesiologist. After your surgery, some patients will choose a patient-controlled analgesia, and that's called PCA. And that's with a little tiny button that you have at your bedside. The PCA gives pain medicine continuously, and with this button you can give yourself little extra doses as you need it for pain management. If you have a PCA, you won't need to have pain shots after your surgery. And these anesthesias, like the PCA and the shots for pain, are really given to patients who are having major surgery and they're going to stay in the hospital for a day or two. It's not meant for patients who are going to have outpatient surgery. Remember, with outpatient surgery or even inpatient surgery, we can give you pain medicines in the IV or even give you shots during the surgery. Sometimes we give a pain shot that's like ibuprofen or Advil or Motrin. We give it into the muscle or into the vein so that the patient has some relief after surgery. When you go home, it's a great idea to take a medicine like ibuprofen or Motrin or Advil. Take it around the clock. If you're a normal, average-sized person, you could take 600 milligrams every 6 hours continuously with some food in your stomach. What that does is it decreases your need for pain medicine like Tylenol with codeine or Percocet. If you have this continuous medicine like ibuprofen, it decreases inflammation from the surgery, and that way you don't have to take as much narcotic. Narcotics like Tylenol or Percocet, those narcotics constipate you, and that can be pretty uncomfortable if you're having to have a bowel movement that's constipated after major surgery. You should have a bowel movement within 2 to 3 days after your surgery. If you don't, give us a call, or you can try over-the-counter suppositories or even an enema. If you've had rectal surgery or surgery close to the rectum, you wouldn't want to use an enema. If those things still don't work, the real powerhouse is magnesium citrate. That'll really get you going if nothing else works. After surgery, if you're unsure about what to call about, just call. We want to answer your questions. If you had an incision on your skin and you see some redness or oozing or actual bleeding, or if the wound's separating, if you run a fever or chills, any of these things, call us. After a laparoscope, sometimes you'll get pain in your ribs, under your ribs or in your chest, and sometimes even pain in your shoulders. Those are normal. You don't need to call about those things unless, again, you're worried about it. Laparoscopic patients will have little bits of air collected underneath their ribs. We try to get all the air out, of course, but sometimes a drop of air or something like a little pocket of air will collect and we can't get rid of that, and that's what will cause the shoulder discomfort and the chest pain, and sometimes even pain in the neck. Those things will resolve within a day or two. Now we're going to talk briefly about the process of what to expect. You usually have somebody drive you to the hospital because we don't want you driving after the surgery by yourself. So somebody's going to drive you to the hospital, and you'll be greeted as in the outpatient department, and they'll tell you everything what to do. They'll give you one of those beautiful gowns and beautiful hats, and then they'll ask you to leave a urine specimen. There may be some last-minute labs. We always do a pregnancy test of people who could get pregnant. We do them at the hospital on the day of surgery. There have been surgeries that have been canceled because the patients are pregnant, and we won't do surgery on them. You'll be asked many times over and over again by the surgical teams, different people, what kind of surgery are you having and why are you having it done? They're not doing this to aggravate you. They're doing this because it's their job to ask you what you know and to best prepare you. So don't be irritated if somebody keeps asking the same questions. They're required to do that. After everything's done and your consents are signed, then you'll be given some sedation medicine. That medicine will relax you and just make you feel so prepared. Sometimes you'll forget what you've said. It's got some amnesia properties. And then at that point, you'll say goodbye to whatever family members are there, and we'll wheel you off into the operating room area. Please don't talk about food or think about food, because as we talked about before, when you think about food, you'll start salivating, and the saliva is not a good thing to have in your stomach when you're getting ready to undergo any kind of anesthesia procedure. The surgeries usually take for minor procedures about an hour, so when you say goodbye to your family members, expect not to see them for about an hour and a half. It's not that the surgery takes that long, it's that the preparation takes a while, and then we like to wake you up from anesthesia very slowly, and so don't expect to see somebody from the time you say goodbye to them for at least an hour and a half for minor procedures. For major procedures, it can be anywhere from an hour and a half to 2.5, maybe 3.5 hours before you'll see the family members. We try to call you when the surgery takes a little bit longer. We try to call the family members in the waiting room so that they're reassured that nothing serious is happening, or we try to give you some information so that you're not waiting. If you don't feel good, you're worried, your family members don't feel good and they're worried, they can call and ask somebody to call into the operating room. That's okay. After surgery, I finish up what I'm doing and I come out and talk to the family members about what we found. I'll show some pictures sometimes if pictures were taken. Please don't keep any secrets from family members. I would hate to go out to the waiting room and tell some husband that we tied your tubes, and the husband says, "Tubes? I thought she was having a cyst removed." You know, we don't lie and we don't tell secrets. There's a funny story about a little old lady who was very forgetful, and she didn't want to tell her husband that she was having cancer surgery, and she was having a hysterectomy for that. This wasn't my patient, but it did happen, and she forgot to tell the doctor, not to tell the husband. So when the doctor finished the surgery, he went to the waiting room and he said, "Well, looks like we took care of your wife perfectly. All the cancer was removed." And the husband with a big mouth said, "What cancer?" So please help me to help you by not letting me get in situations like that. I want to be able to talk to your family freely. So if there's family members that shouldn't be involved or whatever, make sure that they're not in the waiting room. After your surgery, I won't be able to talk to you too much. I'll talk to you a little bit, but you won't remember a lot because the medicine has some amnesia effect, so you won't remember a lot what I say. But I'll give you some words of encouragement and things like that. After your surgery, the next day or that day, you'll kind of laze around the house if you're an outpatient, or you'll go up to the post-op areas in the hospital and you'll be admitted. Family members can stay with you overnight. That's not a problem. They have little couches. They're not very comfortable, but of course, you know, that's the way it is in hospitals. If you go home, just eat what you want to eat. You should be able to recover pretty well. The next day for minor procedures, most of the time you can go back to work, or you may want to take that day off plus the weekend and then go back to work on Monday. Each person will be told a little bit more about their recovery depending on their surgery. If you have a Band-Aid or a dressing on your belly, the next day you can take those off. We usually take them off in the hospital the first day after surgery. I like air to get to the wounds. I think that's much healthier. You can shower for the most part. Even if you have an IV in your hand, in your arm, you can shower. We just put a little bit of protection for that if you're in the hospital. We give a lot of instructions after surgery. In fact, if you're an outpatient, you'll be given an instruction sheet that helps you get through the recovery time. We'll see you then in 2 weeks after your surgery, and we'll discuss everything as I said to you. Thanks so much for listening to this video and allowing me to let you know in this fashion so that I don't waste my voice repeating myself over and over again. I'll be more than happy to talk to you individually now, and thank you very, very much.